presentation is going to be on advocacy, and we need to advocate for each other. So without further ado, let me introduce our speaker, Jen Mead. Jen Mead has been teaching health and PE since 2003. Her current position is at Waterford-Halfmoon Union Free School District. She teaches health at both the junior and senior high. So like many of you, she has to multitask. Jen is passionate about skills-based health education. She was the Capital Zone's Amazing Person in 2008, the health section president for New York State AHPERD from 2017 to 2019, and is this year's New York State AHPERD Health Section Amazing Person. And I could speak personally, I have tried to get Jen Mead to come to our conference for years. I think you're really going to, her passion is just going to reek throughout this presentation. You're just going to love it. As a member of Health Education Advisory and Resource Team HEART, she continues to advocate for comprehensive K-12 health education, lobbying at our state legislature, and she also participated in Speak Out Day in Washington, D.C. She lives in Saratoga Springs, where it's in the 20s today, by the way, no snow, with her husband and 2 children. I'm so excited to welcome Jen Mead to speak about creating a health education program that advocates for itself. Jen, the platform is yours. Welcome, my friend.
Thanks, Lori. And I'm really happy that I'm able to finally do this. The travel was much easier this year, I'll tell you that much. For those of you who are a little hesitant to have your cameras on, I do get that. I have a 3rd and 5th grader who are home today, so if chaos comes running through the room, you can know to anticipate that. I'm sitting right next to a window, so I can yell out and tell him to stop doing something if I need to, but such is life these days. If you can do me a favor, I know you put your name and your school into the chat. Can you also tell me if you're teaching hybrid right now, all virtual or all in person, because that'll help me tailor this to you a little bit better. And while you're doing that in the chat, I'm going to give you a link to my slideshow so that you'll have everything we talk about today. Like any good teacher, I planned way too much, so I'm sure I won't get through it all, but this way you will have it all. All right, so I just put that link into the chat for you. It looks like we have a whole smorgasbord of people doing all sorts of different things, and that seems the case for lots of people this year. First of all, good job. I know educators are working super hard with whatever situation they found themselves in, and we might hear a lot of complaints, but know that for every complaint you hear, there are tons of people who are perfectly happy with your work. Just remain silent about that. All right, I'm going to give this a shot at sharing my screen here, and we'll see how this goes. It might just take me a minute. I usually work on the platform of Google, so we'll see. Let's see. Where'd you go? All right, so can you just give me a thumbs up if I did something right and you can see this slideshow? Yay, I'm winning. So when Lori asked me to present about advocacy, I asked her if she was looking for advocacy that we're doing for health education or advocacy that we can teach to our students. And I decided to do a little bit of both. So my own children are in virtual school right now where they regularly see choice boards. So I tried to create one of those for us. I'm going to put that up on the next slide here. What I've tried to do is come up with a bunch of different things that have to do with advocacy. And I'm going to ask you to weigh in on which one of these things you'd most like to learn about. So let me first just give you an overview, and then we're going to go to that website that you see at the top of the screen, the pollev.com, GenMead298, and you can actually weigh in by ranking which one you'd most like to see, and then I'll tailor the presentation to kind of fit the needs of the majority. So we have statewide advocacy materials where I can talk to you about a video we made several years ago, and a new letter that I wrote that you can steal and send to your representatives to advocate for health education statewide. I have some information about school-wide data collection and how you can, at your school, use the Youth Risk Behavior Survey and School Health Index to help advocate for your program. Some school-wide events that I can share with you, specifically an idea for Every Kid Healthy Week, which is put on by Action for Healthy Kids, and some wellness fair information. And then I have things that are specific for the health ed classroom. So things you can do with your students for advocacy, where they're learning the skill of advocacy, but they're also kind of innately advocating for your health program at both the junior high and high school level. Or if you just want to be able to talk to one another, we can choose that care to share. So if you haven't done so already, can you try to go to this website right here, this polev.com/JenMead298. And once there, you're going to be able to rank order these so that I can see where we should spend our time today. And I'm going to pull that actual window up here. So I'm going to try and stop sharing and pop back in and see if I can do it again. All right, so we should be seeing our results on the screen here. I'm going to move me over. All right, and just give me a thumbs up if you can see the rankings right now. Great. So I'm going to give people another moment just to click in and tell me what they'd like to learn most about, and then we will try and go in that order. I'm just going to jot these down so I keep track of things. Oh, they're moving. This tool, if you haven't used it before, is a free tool. Poll Everywhere. You can use it with your students. I use it for a course evaluation at the end of the year. You can do rank ordering. You can do word walls. You can do open-ended questions. And on the free version, you have a little less options than the premium version, but I've seemed to manage free for a while without much problem. Okay, so I'm going to take what I currently have. All right, so we'll start with senior high. We'll give people a chance to share, then we'll maybe jump into the junior high. And if we have time, we'll pop into those school-wide events and data collection. You will have access to all of it via the slideshow, however. Okay. All right, so let me exit out of this and see if I can pop us back into this slideshow. Lori, I've got people showing up in the waiting room. I don't know if you can admit those or if I can. Oops.
Yeah, we're working on it. We're getting them in.
Okay. So when you are in the slideshow yourself, all these arrows are just links to those sections if you want to get directly to those sections in the slideshow, or you can just move how you need to throughout the slideshow when you're using it yourself. So I'm going to flip forward to the senior high work, and I'll show you a few of the projects that I do with my students there. So I'm going to start with the one in the middle, which is the CHOPPED challenge. When I teach planning and goal setting with my students, I also teach nutrition and physical activity. And one of the projects I do with them is called the CHOPPED challenge. If you've ever seen the show Chopped, that's where it was motivated from. So this is actually a link to that slideshow, which is how I have the students complete the assignment. This is an assignment that I think you could easily do with students in any of your conditions, be it hybrid, virtual, or in person. So I'll go over this with the students, but they also get a copy of this because it's where they build their work. My goal in doing this for them is to kind of highlight how to plan meals and some of the nutrition information that we've covered. But then how does it relate to advocacy? The finished product is actually a digital cookbook that I send out not just to my students, but to their parents. And I also have posted on our district's website. So it automatically creates something that shows health education is doing something, and hopefully that it's useful. So essentially, the students are required to design a meal. I usually have them work on this in teams, but they certainly could do it on their own. That follows some of the rules we've talked about, that they're mostly plants, their ancestors could recognize the food, the 5-ingredient rule, that it's got all the colors of the rainbow, and so on. And then they go to Hannaford's website, but you could use the grocery store that is most local for you. Most of them have a shop online tool to shop online for their products to make sure the ingredients actually match those rules. In this slideshow, you'll have the rubric of how it's graded. I'm not going to go through that. I'm sure you can figure it out. I have a couple of slides that help the students understand how to work their Chromebook if they're not sure how to copy and paste pictures or take a screenshot. And then each of these cookbooks is actually linked to a website where they could get recipes, although I have students sometimes use family recipes as well. I show them my example in which I followed the directions, right? You have an exemplar where you have a link to the actual recipe itself, a picture of the recipe, and kind of how to serve it. And then on the second slide that the students create, they actually have done the shopping where you can see the actual ingredients. Needless to say, they create these same slides themselves. And then on the back end of this, I take all the slides they've created, put them all in one slideshow. We have Google at our school, so I put them all in Google Slideshow and save it as a PDF, and that becomes this digital cookbook that goes out to families. So in the curriculum I've designed, I try and make sure that with every learning experience, there's something that students create that either goes out to the entire school-wide community or it goes to just the students or just the parents, so that the work that kids are doing in class actually leaves the classroom. And I find, one, it helps advocate for my program, but two, sometimes it propels students to do better work because they know it's going to be shared out. While you probably can't do this in the COVID era, I then have students vote on the meal they'd most like to taste, and then I make it for them and they get to taste that healthy meal in school. So the one you're seeing is the one that won last year, which was a whole grain French toast with cauliflower hash browns. That can be a challenge to kind of make in the classroom, but we make it work. That's one example of a project your students could do in class that then advocates for your program. If you have questions, please pop them right into the chat as we go, or comments, or whatever might work to make this more meaningful for you. The other project that I do similarly, where it gets shared out to the community, is the High Stakes Health Project. So I'll show you that on these next slides. Students come into the classroom and I have these cards cut out. This is my trick to get them to come to class on time. We know high schoolers, right? So in class, if I have kids in person, the first kids to arrive get their first choice of topics. You might be able to do this virtually by having kind of a sign-up board as soon as they show up into your Zoom or your Google Meet. Once they've chosen those, I do give kids a few minutes to swap topics if they want to. For example, if the last kid in the room gets left with sexual assault and they're a victim of sexual assault, they may or may not want to take on that topic. So I do allow some swapping so that students can do something that doesn't put them at too much risk. And then each student, or in pairs or groups, whatever works in your setting, kind of finds the information for these questions. This is following when we learn about how to find valid sources of information. And so the students are asked to find an accurate definition of the term, find a statistic. Because we do the youth risk behavior survey at my school, they can sometimes use data from our school, which is particularly compelling. And then because we're in the capital region, they have to actually locate a local resource service where they could get help for this, and then find out what they could do to help someone who is in this situation. Then they use a tool called Canva. Let's see if I can put this into the, it's just canva.com, canva.com, to build these infographics. And then these infographics, I actually have printed on large paper. And one of my favorite ways to get messages out to my students is to plaster them on the inside wall of bathroom stalls. So when they close the door and they're sitting on the toilet, they're a captive audience for my information. Sure. They love taking me to the bathroom. We put these up on the inside of the bathroom stalls, and then my students have created information that hopefully is helping everyone in the community on these particular topics. And then because they are PDFs, I actually share those out as well to the larger school community. My school uses a Facebook page, so I just asked our Facebook administrator to put those out to the community as well. Again, it's a moment in the curriculum when what you're doing in the classroom is actually going out to community, and it makes your program something that they remember. So if your program ever is on the chopping block, they know the work you do. This is just how that is graded. And just as an FYI, once we have all these infographics, when I teach communication skills, the students, I have them do conversations with me about these high-risk topics, where I actually have them program those local resources right into their phones. And then when we have those conversations, essentially role plays, they can recommend to me, I'm always the victim, or the one with the troubled behavior. They can recommend to me where I can go in my own community to get help. The added benefit of this is, since they have to program it all in for these conversations, they're also in their phone, so that if they ever need them in real life, they actually have those resources all plugged into their phone. So the project kind of has multiple uses. And then we actually do an advocacy project. So I have several links here. I think based on the scenarios that we're in, I will show you just a couple of them. This is the one that I used last year when we were in all remote learning. So these are all links to what the students get. I'm going to share that with you so you can just see that. Oops, thought I was going to share that with you. All right, and can you just give me a thumbs up if in a moment after we get past this loading screen you see final advocacy project? Okay, so this is actually how I taught this remotely last year. So you see that I'm asking them to type their name in the chat. In their advocacy project, they had to choose to write a letter, create a petition, or a promotional video. And they had chosen topics based on our school's needs. So again, we use those data collection tools, the Youth Risk Behavior Survey and the School Health Index, and they can look at our results from both and then choose a priority area of need on which to base their project. I actually have the students do the School Health Index. My high school students complete the School Health Index every year, and we ask our administrators, our school nurse, stakeholders in each of those modules to come work with us so that we have that data. And it proves very useful for a variety of reasons. So then I gave them some tools about how to actually go about writing a letter if they're writing it to the Board of Ed, the principal. We have a lot of people interested in changing what happens in the cafeteria, so we had our cafeteria manager on there. My favorite tool that we used last year was in creating a petition. And again, I asked my students to make sure they shared this with me before they solicited signatures. One of the things that is important if you're growing a program that advocates for itself is that you get eyes on a product before it goes out to your community, right? So those infographics I look at and make suggestions on before they ever go out. And that helps kind of protect the validity of your program also. So you're only sending out professional information. So I don't know if you've used this tool before, but change.org is a free platform on which you can create a petition and then they can share it on their social media accounts. Last year, we had students put out a petition. I teach in a very small school district. There's about 60 to 70 kids per grade, 60. And they were trying to get sidewalks and bike paths from the village up to the school. And they had over 100 signatures within a week on their change petition. So it's a tool they can actually use. And again, these things are actually finding their way into our community. The other great thing about this is when they propose solutions, we can share those solutions with the Board of Education and use our school health index and youth risk behavior data to support those efforts. So we were able to get a grab and go breakfast instituted as a result of student efforts from their advocacy project is just one example. And then they also have the option to make a promotional video. I discourage them most of the time from making videos because I think they have very high hopes of what they'll look like, but oftentimes they come out a little yucky. But my students who are really gifted sometimes take this on. So this just gives them 3 different ways to actually do that advocacy project. Again, you're going to see the way that they're graded right in this slideshow, and you have links to that yourself. Does your screen often look like this with 9,000 tabs pulled up at a time? And then this one is one I've done traditionally. This involves the school health index. I'll try and shoot through this one pretty quickly. But essentially the kids are broken up into groups from different periods. So all of the modules are covered, but it might take me a few of my classes to get all those modules covered. So their group creates this PowerPoint. I usually have a different student assigned to different slides, even though they kind of work on that as a group altogether. And again, I always try and get someone from another stakeholder involved in their group, whether it's the superintendent, the principal, the school nurse, the cafeteria manager, a parent. We pull them in. They just actually do the school health index, which you can train them how to do. It's a pretty simple process. And then they create the score here. They come up with a solution to some of those. So once they have these areas of improvement, they come up with a solution they think would be realistic and would help with one of those areas of improvement. I tell them to come up with a catchy name for it. Last year, there was a group who was really interested in trying to get more restorative justice into the school and was trying to have kind of a student council to make decisions for disciplinary actions. They type out a description, which they've decided as their team. They use a statistic from our school health index, our youth risk behavior survey to help compel the audience to pay attention to it. They develop a rationale, they come up with a process, and then a takeaway message. What I found is that then I can combine all of their slideshows, and as the health educator, I can go to the Board of Education with or without my students, and I can present all the findings from the school health index and all the solutions, right? So I've had my students do the legwork to hopefully improve their wellness community. All right, any questions about the high school stuff? And Lori, remind me what time I have until?
You are over at 11. If you want to leave a little time for Care to share, you can end a little earlier than that, but you are done at 11.
Okay, so I noticed in our poll, Care to share actually came up second in the rankings. So should we take a moment now if I stop sharing my screen here? I know that in my mind, I was thinking we could discuss what needs there are for health education or what advocacy strategies could be employed to help meet those needs. I'm happy to take some time now, since it seemed to be on your priority list as participants, to maybe have that discussion. Does anyone want to weigh in with the chat or unmute and talk to us about what they see as our needs or some of those solutions? I'm waiting those 5 seconds.
For myself, because I need to weigh in as a retired health educator. When everything came to fruition with COVID and the pandemic, I felt a little at loss. Like, how can I help my kids, my community? How can I advocate for health educators? And more, you know, as the vice president for health education with the Suffolk zone, people are reaching out to me saying they're cutting my program when we should be on the top of the list of things to do. So it was very disconcerting to me.
Yeah, I think all of us are probably worried about what these inevitable cuts will do to our programs, because we're so used to being the first on the chopping block. And so it is an opportune time for advocacy for our profession. I don't know what else could be a better reason to make sure there's health education in every school when you're facing a pandemic, you know, that this is an opportunity for us to not only educate our students, but their families, and empower people to recognize that their choices when it comes to health have a big impact not only on their own lives, but on others, right? I mean, this is what the governor of our state has been on the screen doing since March. So I see some people popped into the chat that they agree. One thing that I can say is that I tried to reinvigorate some discussion with New York State AHPERD about jumping on this opportunity to advocate for health education statewide. We had a lot of conversations about trying to get that associate back at State Ed for health education, because that position has been vacant forever. So in the slideshow itself on those statewide advocacy efforts, the letter I wrote is requesting that that position be filled so that we can update our standards, which are also ancient. I also said that perhaps we can require I mean, these are big goals, these are lofty goals, require a certified health educator in our elementary schools, and that we really should be doubling the time that is happening in our junior high and high school health programs rather than cutting that time. So what you can do, and actually let me see if I can share that section for us for a minute. In the statewide advocacy materials, there's an old video from 2017 that you can use for any purpose you want to, or you could include that link in your letter. At the New York State AHPERD's Advocacy Center, you can get the names of all your state representatives and their addresses and email addresses. And then this is the letter that I wrote most recently that you can link to, that has a request of all those things. I'm going to show it to you quickly just so you know how you can alter it to suit your needs and send to your representative if you choose to. I'm a wordy person, so feel free to take the letter and do whatever you want. When I wrote the letter, New York State had nearly 500,000 confirmed cases of COVID and over 25,000 deaths. But if you go to these links, they'll take you to those dashboards where you can update those numbers. If you're sending the letter and you just want to copy and paste, you can do that, but then update your numbers so it goes with the date. And the letter just talks about how never before has there been a greater need for health education. And then bulleted here are those things I just suggested, that we should have that health associate so we can revise our standards, so that we can revise commissioner's regulation to require elementary health taught by a certified health educator and increase the current requirement in the junior and senior high school. and that we can support the needs of health education programs in New York State, specifically also looking at higher ed. Those of you who are in higher ed know that these programs are dwindling, and the number of students who are taking health education teacher preparation programs are dwindling as well. And there's a very real need for health educators in some parts of the state. It also talks about how, although the pandemic is unique, there's always something, right? Before the pandemic, it was the opioid crisis, which is not gone, right? It's happening simultaneously. And we had updates with regards to awareness for mental health also going on simultaneously. And that in years past, maybe it wasn't COVID, but it was the AIDS epidemic. So there's always, no matter what point in history we're at, there's always something in public health that supports our need. And the last thing I just want to show you in the letter itself, this paragraph is about myself, and I would encourage you, if you do steal the letter and send it to your representative, that you replace this example with an example of yourself. So this example just talks about some of the work I did with my students when schools were closed, specific to COVID. But I'd encourage you to alter the letter so it represents what you're doing, so that maybe it rings more true to the representative who's reading it. So you can steal this letter, you have the link to it, and hopefully you will. And hopefully it also helps reinvigorate some of the work that's being done amongst New York State AHPERD. So both Colleen Corsi and Clancy have the letter now, and hopefully we are able to maybe send out another letter writing campaign, or get a hold of the powers that be to help encourage the growth of health education rather than the demise of health education. Does anyone want to weigh in on any of that? Because I know Care to Share was the second thing you had, and we haven't had much sharing yet. So I'll give you a moment if there's something you want to add or share. Okay, so the third one that came up on our rankings was junior high activities.
If I could interrupt for 1 second. In the chat, someone asked if at the state level, they're throwing around the idea of changing the current requirement from a half credit to a full credit in both the junior and senior high. Is it something that's being spoken about?
Well, I did. So I think beginning in 2017, I started traveling to the state with Colleen on behalf of New York State AHPERD, trying to push for additional time in health education. One of our biggest spiels at that point was that we have 20 weeks in the junior high and the senior high to cover over 35 topics that are required by law for us to teach. And that we simply, no matter how fantastic we all are, we can't do those topics justice in that amount of time. So since 2017, and I'm sure prior to my involvement at all, we have been pushing for that. When you are at the legislature, they'll often redirect you towards state ed, and when you're with state ed, they'll often redirect you towards the legislature. So there is the expected bureaucracy of figuring that out. I think we have to continue to be relentless in our advocacy. So although it takes a little additional time, if there is the possibility of you sending those letters out to your representatives, it does absolutely make a difference. If you think about what happens in your own school board of education, it's not necessarily the biggest concern that gets the most attention, it's the loudest voices that do, right? So I think about years ago teaching sex ed and having one family be really upset about what we were teaching, and the amount of noise that one family made pushed this all the way to the Board of Education. Thankfully, we were able to keep teaching how we were teaching, but if we're the louder voices, we're more likely to have some impact. I wish I had better news that I could say, yep, there's a bill being passed, or commissioners' regs have been revised and they just need to get signed through, but I don't have that news right now. So I think all of us have to do our part in that, and hopefully we'll continue to do some of that through New York State AHPERD. Another reason why your membership is really helpful.
I'm just going to interrupt for one moment, Jenna. I'm just going to implore you, I've been imploring all along, please turn your cameras on, because to see the people shaking their heads, agreeing with you, we're so small, but together, you know, we do have a voice. And to see you shaking your heads and agreeing with Jen and advocating for the profession of health educators, I think it's respectful to our presenters. It's encouraging to the rest of us who are maybe the only health educator in a building to know that there's a group of us that stand together. So I just think it would be great if you turned on your cameras and, you know, gave Jen a thumbs up. She's working really hard for all of us, and we don't want to see our programs go down, but we want to advocate for health education. And Jen is probably one of the most vocal people on the state level. And it's nice to know that she has all these people backing her up. So if you could turn your cameras and just shake your head and agree and give it a hoorah. I know she would appreciate it. Thank you, Jen. Sorry for interrupting.
That's okay. I'd also encourage you, in addition to that letter, if you can employ the Youth Risk Behavior Survey and the School Health Index in your schools, that data is so useful in your buildings and in your districts to compel people to stick with your health education program. And it's informative to you as a health educator. I'll show you my school scorecard in a moment here. And when you are writing those letters to your representatives, you can use your local data. I presented at a hearing for the assembly where they were discussing mental health, health education, and physical education. And statistics don't mean much until you're actually talking about your students. And I did find that using those local statistics seemed to have an impact, at least in the moment, on conveying the importance of what we're doing in our classrooms. Okay. So I'm going to show you the junior high stuff, but I'm just going to quick share with you about the Youth Risk Behavior Survey. My first year teaching at Waterford, I had been so used to being at my previous school district where we have the Youth Risk Behavior Survey done from an outside source and having that information that I was a little heartbroken I didn't have it at my new job. And I talked about it all the time with my students. So when we got to our end of semester advocacy project, my 8th grade kids wanted to do pregnancy prevention because Waterford had a higher than average teen pregnancy rate. But I had a group of kids who wanted nothing to do with that. And so they took on the Youth Risk Behavior Survey. And what they did is they made a Google form. They hand typed every question from the Youth Risk Behavior Survey for both the middle school and high school survey into a Google form. And because they did that, every year since then, I've been able to collect data from my students using the Youth Risk Behavior Survey. So this link takes you right to CDC where you can get the actual forms. And I regularly use this data, and whenever I see those students, I tell them what an impact their work did. You know, to them, maybe it just felt like typing, but it had a huge impact on what we're able to do at the school. And I've given you some information about how I do the school health index at my school also. This just shows you some of the data I've collected at my school. So it's showing that over a quarter of my students said they had been bullied electronically. This one is heartbreaking. Again, nearly a quarter of students had seriously considered suicide. This talks about on how many days in the last 30 did you use an electronic vapor product. I use this in 2 ways. One, I don't know about you, but my students think every child vapes except them. And so this data helps to show that, you know what, you're not in the minority if you don't vape. But I also then can say it is pretty much an issue though. We still got to do something about it, right? Have you ever had sex? Nearly half of my high school students respond yes to this question. Again, this gives me data. If I do have a parent who's concerned about my sex ed curriculum, where I can say they really need to know this, right? Or if my superintendent is giving me a hard time about something, I have data to back up what I'm doing in my classroom. And it's also something that provokes the students in their own advocacy projects. This is my school's scorecard. One of the things I want to point out is I've done the school health index with a middle school, a pretty affluent middle school. I've done it with the junior and senior high I currently work at, where we have about half of our students on free and reduced lunch. And I've done it with my children's elementary school. Every single place I've done it, employee wellness and health promotion is always the lowest score. It's not usually this low, but this always comes up as something that's important. And the school health index will give you ways to how to address that. I think particularly now with teacher burnout and just being overwhelmed, this is something that we could really point out to our administrations. But having this data helps present to the school what we need to do better. And it also helps me as a health educator. So here I am thinking I'm pretty awesome, but look at the score I got for health education. Never in my academic career did I ever receive 79. I'm that girl. So having received this, I knew what I had to do to improve my curriculum. So this one is from 2 years ago. And I was able to know that I really had to look at chronic disease and put more chronic disease prevention into my program. So I'm able to adjust my program as a result of that. All right, let me see if I can get us back here. And I'll share some of the junior high stuff. How's my time, Lori? I can't see my clock.
4 minutes. Wow, 4 more minutes.
Okay, so again, you have all of these things. Having seen the statistic from my school about the percentage of students who had seriously considered suicide, when I taught stress management, I added mental health kits to that unit. And my 8th graders created mental health kits for the 7th graders and the 6th graders. Our 6th graders are in the elementary school at my district. So 7th graders are like newly entering the junior high. And I'll just show you that. So these were the requirements for their junior high survival kits that they actually created. And you'll have all of this as well as how that was graded if that was something you wanted to add in. Again, this helps promote your program so that not only your students know about what you do, but you can spread it all the way down through your elementary schools to benefit them. I also have had situations where I had my students write a children's book that the main character had some sort of stressor and they applied an appropriate strategy to cope with that stressor. And then those storybooks we delivered to the elementary classrooms so that our elementary school teachers who are charged with teaching health education might be able to use these stories to teach some of that information as well. So there's some links in there that might help you with that. And then one advocacy idea as a possible extension after all of your learning experiences could be to have your junior high create a newsletter that then is distributed to your elementary school classrooms and to your elementary school community. So I'll show you just a quick example of that as well. After finishing planning and goal setting, we created an issue, and I just did it in a slideshow where each one of these titles represents a different slide. And so each student had to complete a different slide. This is an example of one. And once it was all done, we saved it as a PDF, and then that newsletter was sent to the elementary school classrooms and to their parents. So rather than having be a big advocacy experience at the end of your semester, it could also be something that you do as a summative assessment at the end of your learning experiences. All right, you have all of this in the slideshow. I didn't get through everything, but I got through an awful lot. If you have questions, my email address is in the slideshow itself, so you're welcome to email me. And please, if you're so inclined, take an opportunity to modify that letter and go to New York State AHPERD's Advocacy Center so you can send that off to your representatives as well. I'll stop sharing now and can take whatever time you'd like to share any thoughts or ideas or ask any questions.
First, I'd really like to thank Jen for sharing her advocacy and our passion with her Long Island health educators. Jen, I can't thank you enough for joining us. We'll stay on for a few minutes and you can write questions or unmute and ask Jen any questions you may have about health education at the state level or some of the lessons she shared. I'll be getting the upload of her presentation and we'll be putting it on the Suffolk Zone website to share with all of you. The next session will begin at 11:10. But like I said, we'll leave it open for a few minutes if anybody has any questions for Jen. The last session begins at 11:10 and will end at 11:55. And we'll be talking with John Martin and maybe Nancy Hemmendinger from Suffolk County Department of Health at that time.
I saw a couple questions pop up. Someone was asking about elementary health ideas. The ones that I can think of in the slideshow itself, there are coping books, and it's a list of children's books for particular coping strategies that can open up some nice discussions in elementary health. Additionally, the document that we put out for New York State AHPERD this summer, if I have some time, I'll pull it up and see if I can attach the link to you, though I think you might need to be a member to access it. It has resources specifically for the current environment that we're in for both elementary and secondary health classrooms, and it's coded by skill and by content area. Did anyone see that when it came out by chance? It was kind of guidance for reopening. I'll see if I can pull it up while I'm still on, and I'll share that link in the chat for you.
I shared that document in, I have a resource document that'll be shared with everyone, and that document's in there, Jen.
Yeah, so it has links to lots of resources for both levels, and it's in charts so you can tell what skill it's intended for, what functional knowledge area it's intended for. Hopefully that will be helpful as well. And then someone asked about sharing a copy of the youth risk behavior form. I did that before and it didn't work very well for the person, but I'll make another copy and see if I can share a link with you before time is up today. I'll just pop back into the chat and share that link, or I can send it to Lori as well. I can do both.
Perfect. Sounds great. All right, so we'll see you all back at 11:10.